If by the end of this video, you don't understand everything about fibroids, block me. Block me. But in the meantime, let's teach you fibroids. Where's my yes? Thank you very much. Thank you. Thank you. Thank you. Thank you. Now, I'm sure you have been on the side of the road and they've told you, they cure fibroids, they cure this, they cure that. And one of the things that they actually use to actually deceive you people is fibroids. Why? Because it's actually very common. But you need to know about fibroids because they are more common than people think. But you also need to know enough so that they will not bobo you as they are boboing you. So in this particular video, you're going to learn a couple of things. Number one, what fibroid is, the different types, the symptoms to watch out for, and most importantly, the treatment options. So that they will not go around deceiving you people and telling you that, if you mix this and mix Kono and mix this and mix that, if you drink my tea, fibroid shrink green tea, for instance, is a lie. It does not work. But now we are taking attendance. So put in the comment section where you are watching this video from. Let's know who is in class today, Aproko Nation. First of all, what are fibroids? Number one, fibroid is not cancer, but is a growth, a small lump, big lump, different sizes that grows in and around the uterus and can cause problems. Sometimes big problems, sometimes small problems, sometimes other problems that are not related to the fibroid itself. Now, doctors don't know exactly what causes fibroids or exactly how fibroids form, but we know some things. Yes, give it to us. We know some things. Number one is that there are certain hormones like estrogen and progesterone that are involved in the growth or the reduction of fibroids. Number two, if your mother, your sister, or your grandmother have fibroids, the chances of you having fibroids is easier. Doctors know that one. Number three is that the risk of getting fibroids if you're over 30 is high. If you're overweight, is high. If you have low vitamin D levels, is high. Doctors know this one. There are other things that doctors need to know, but before we go any further, you need to say yes, like this video, subscribe is somewhere here. Put the bell button on so that you don't miss videos like this when they come out. There are important health videos that are going on this channel, and if you miss it, your fault. You might actually be surprised to know that 80% of the people who actually watch this video or watch this channel are not subscribed to the channel. Another thing that 80% concern is that 20 to 80% of women might have fibroids before they turn 50. Yes, that's another 20 to 80%. You see what I did there? And that's a big range. It's very large. But some people will not even know that what is doing them is fibroids because they don't understand the symptoms or don't even show symptoms in the first place. Now, fibroids come in different types depending on where they grow. The first is where we call intramural fibroids. Intramural fibroids just simply means inside the muscle, right? Now, they grow inside the muscle wall. So this is the muscle wall of the fibroids. They grow inside. That's intramural, right? Inside the muscle itself. There's another type called subserosal. Now, serosal is outside. You can see that, yes, outside. The subserosal fibroids go outside the uterus, somewhere here, outside. And they can grow to any size. They can make one side of the belly look bigger depending on where it's growing from, or just be that one small lump. Another one that you also need to know about is pedunculated fibroids. They are subserosal, but they grow like a stalk. It's like beans that is attached to this thing. There's another one you need to pay attention to called submucosal. Now, submucosal grows inside the normal skin of the fibroid. Hope you're zooming in, see what I yes. And this particular one, sometimes it can attach to the place where the placenta is supposed to attach. And when the lady gets pregnant and the placenta tries to attach to this place, it can affect the pregnancy, leading to miscarriage. That can happen. Another thing that can also happen is that a type of fibroid can also grow around the cervix. It's rare, but it can happen, and that can lead to different problems. Now that I've told you about the different types of fibroids, we now need to talk about the different symptoms that fibroid might come with. Now, just because you're feeling these symptoms does not automatically mean you have fibroid, because part of this video is actually to educate you, not to diagnose you or diagnose. Just know one of the things the video is supposed to educate you, right? Now, symptom. Number one, if you have heavy bleeding during your period or even in between your period, it can be a problem. It's usually because of the position of the fibroid. And the ones that lead to that are the ones that are subserosal. Another thing that can happen if your period is lasting longer than normal, if you're having strong cramps, if you're having pain in your lower belly, if it looks like your stomach is always full, even though if you've not eaten, but your stomach is always full, if you are looking like, where is this belly fat coming from? I've done all the sit-up in the world, you have done all the ab exercise in the world, but your stomach is not coming down. It might be fibroid, because this fibroid is inside the woman's pelvis, and because of the size, it can grow bigger, like I said, depending on the size. Sometimes, if you also see large blood clots during your menstruation, it can be a sign that you have fibroids. Sometimes you're just menstruating and then you just feel like something just came out of you. Yes, sometimes sign of fibroid. If you are urinating very often, let me explain how that thing happens. Now, because this fibroid happens in the uterus, right? Fibroid is inside the uterus, depending on the size. The bladder is just under it or in front of it. Let's just put the word. The bladder is just there. Now, if the uterus is now resting on top the bladder, it now means that any small thing, any small water you drink, your body will need to remove the wee-wee from your body immediately. So you might be noticing, this one have gone to the toilet like 14 times today. Are you sure it's not diabetes that is doing me? My sister, it might not be diabetes, it might just be a big fibroid. Are we okay? Another thing that can also cause is that you might have pain during sweat. Yes. Depending on the position of the fibroid too. So you need to understand that the fibroid can cause the symptoms based on the position that it is. Some women are very lucky and they notice that, once I just reach menopause and those hormone levels that we talked about, estrogen and progesterone that we talked about in the beginning, they can shrink on their own, especially after menopause, because these hormone levels are dropping. But if they are causing serious problems for you, there is treatment. You have not lost hope. Now, the best treatment for fibroid will depend on the size of the fibroid, the numbers of the fibroid, if there are more than one, the location of the fibroid. What are your treatment options? Number one, watch and wait. Yes. They do watch and pray someplace, but this one, watch and wait. If fibroid is not bothering you, leave it alone. The doctor might suggest that you just do regular checkup instead of trying to disturb something that is not disturbing you. Because especially if you've not completed your family, anytime you cut into the uterus, especially during surgery, it can lead to some problems. Another thing that can also help is that there are some drugs but this one does not really treat it per se. There are some drugs that can shrink your fibroid, right? Shrink it so that the doctor can go in immediately and try to remove it. Because if you just take the drug for shrinking and you don't do anything about it, that fibroid is gonna go back to its original size. Shogba. So, but some people, they do it just before menopause, so that it shrinks, and then menopause comes in, and then the hormones, everything just shrinks together. But you see, this particular conversation I'm having is between you and your doctor. So I'm going to say, hey, Aproko Doctor tell us that there's the drug that can shrink fibroid. Before, one stupid person on Facebook now will now use this thing and do AI. I'm saying you people, and God will catch up with you very soon. That's why, yes, I'm going to start speaking good English on the internet, because it's like when I speak good English, people will carry AI and put on top of it. I see you. Now, another thing that can also treat fibroid is non-surgical treatment. Now, there are some treatments for fibroid that will not determine for them to cut your belly open like your abattoir. No. It's new technology. It's called technology, and they call it uterine fibroid embolization. What does this simply mean? They are trying to block the blood flow of the thing that is supplying the fibroid. So in other words, if the fibroid is eating blood, they go and block the tap where the fibroid is eating blood so that it can shrink. How did they do it? They'll just find one small hole in your body, and they will now put one small pipe and trace the pipe until it gets to the fibroid, and then they find the blood vessel that is supplying that fibroid, and then they block the tap. It's like if you refuse to pay water, this thing in your compound, and they are begging you, pay water. You say, no, I'm a problematic client, I'm a problematic tenant. You'll just go to the tap that is behind your house and block it. And now your house is smelling. That's basically what they are doing. Uterine fibroid embolization. So they are basically forcing the fibroid to starve. You get it? Yes. Now, the least and the final one that usually happens is surgery. Yes, depending on the size of the fibroid. Sometimes the fibroid is too big, it's causing serious problem. It's so much she can't eat. She's having indigestion. That's another thing that fibroid can cause, depending on the size and the position. If it's happening up, it can push the belly up and cause gastric reflux. Yes, it can also happen. I've seen it happen in some patients. Like I said, it can cause problem down. It can also it can cause problem down. It can also cause problem up. If you're laughing, me and you will speak English, and they will see who is better than the other one. Surgery is also one of the major treatments for fibroids, right? So if the fibroid is very problematic, then you do a surgery called myomectomy, where your doctor will have to assess the risk and the benefits before they do it. Some other people, they can say, you know what? This is usually the last option. Let us remove the whole thing. It's called a hysterectomy. They just come from here, just cut everything, cut the whole uterus, and we put it in. For some people, they can say, you know what? Let's not just remove the uterus. Let's call it a radical hysterectomy. And then they remove even the ovaries too. Gone. You're now asking, if they remove my uterus, what's going to happen? Am I still going to be able to? Yes, you can, because they're leaving the vagina for you. Now, Nkechi is now asking me, Aproko Doctor, now that you have mentioned this thing, what are some things that I can do or change in my life, just to help this fibroid whole thing? There are some things that you can do. Eating more fruits, vegetables, change, your diet. Some of you need to drop junk food alone. Yes, I'll keep putting junk food in any wrong thing. Number 2, keep a healthy weight. Stress, manage stress, get enough vitamin D, go outside, let sunlight touch you. But make sure that you wear sunscreen if the sun is too hot. Morning sun, please. Some of you are going out by 12 o'clock. That's not vitamin D anymore. I don't know what it is. Vitamin sunburn. Now, you have watched to this point. Clap for yourself. It means you care about your health. Yes, but I have a problem with you. In the beginning, where I say subscribe, you did see you did not see it. Please go back there and press it. Thank you very much. Now, there's another thing you still need to do. There's another person in your life that actually needs this video. But you're stingy. Some of you find it very easy to share prayer link. But when it's time to share link that can help people knowledge, we will not share it. So share it. Yes. But let's be serious. Fibroids don't have to control your life, right? But if you see symptoms, please don't ignore them. Find your doctor, get it checked. The sooner you take action, the better. If you cannot get access to a doctor as quickly as possible, go to WhatsApp and ask our doc questions. It's gonna answer you and connect you to a doctor fast. Director, my video finished. Let's move on to the next video.